Hello everyone. Today I'll present diabetes mellitus as a group health challenge. So this is a disorder in which the body does not produce enough or respond normally to insulin, thereby causing blood sugar level to be abnormally high and urination and fast increase, and the person with diabetes lose weight. So this is exactly what happens after we eat. The food is broken down in the stomach into sugar, and the main sugar is called glucose. And this is absorbed through the stomach or into the bloodstream. However, to remain healthy, your blood sugar level should not be too high or too low. And this insulin is a hormone that is secreted from the pancreas, and its main job is to monitor your blood glucose uh, level. And when the blood glucose begins to rise after eating, the level of insulin should also rise. And this insulin acts on the cells of your body and makes them to take in glucose from the bloodstream. Some of this glucose is used by the cells for energy, and some is converted into glycogen. When the blood sugar level begins to fall, that is before meals or when we have no food, the insulin also falls. So this is what I was explaining. And another thing I'm going to look at is the complications which is associated with diabetes. And the first one being kidney complication, nerve complication, eye complication, and cardiovascular complication. So we'll look at each complication separately and see how it does happen in our body. So as I said earlier on, that the first complication is kidney complication. So also look at it, kidney complication. So this is a damage to our kidney, and it happens when high blood glucose level damage the blood vessels in the kidney. And many people with diabetes have high blood pressure, and this high blood pressure damage our kidney. And statistically, 1 out of 3 adults with diabetes has a kidney disease. And if the kidney is not functioning properly due to damage, it fails to remove waste products from blood and even remove some excess fluids from the body. And another complication which you are going to look at is nerve complication. And this is a damage to our nerve, and we call that neuropathy. And more than half of diabetic patients suffer from this neuropathy. And it's also one of the common complications associated with diabetes. And there's different types of symptoms, and these symptoms range from pain to numbness in the feet to problems with the functions of your internal organs such as heart and bladder. And we'll also look at another complication, which is cardiovascular complication, and has to do with our heart. And I'll also explain a bit about cardiovascular complication. So this is also a cause of heart disease, and in a person with diabetes, there's that hardening of blood vessels in the heart. And what happens is cholesterol in the blood vessels is built up, and it also affects the part that supplies oxygen and nutrition to the fat as it builds up. And this cholesterol plaque breaks apart or rupture, and the body tries to repair the rupture by sending platelets to sew it up. And since our arteries are small, then the platelets block the flow of blood, not allowing oxygen delivery, and then a heart attack develops. So that's also what happens with cardiovascular complication. And lastly, we'll look at eye complication, and this is a damage to our eye, and it's also one of the leading cause of blindness. And it's caused by damage to the blood vessels of a large sensitive tissue at the back of your eye or the retina. The damage to the eye starts when the sugar blocks the tiny blood vessels that go to your retina, causing them to leak fluid or blood. And to make up for those blocked vessels, the eye then grow new blood vessels that don't work well, hence increase the risk of developing cataracts. And we'll also look at those are some of the complications associated with diabetes. And now we'll look at monitoring diabetes so that we can also know if we are diabetic or not. So this is also how they test. They use a gadget called glucometer, and when testing, they use blood from a finger prick, and that blood, when that blood is tested, it also shows if a person is diabetic or not. And normally people are encouraged to check their blood regularly, and that helps the patient and the doctor to see how the person manages their blood. So this is also done after the person has taken a drink, and it's a 2-hour test, and sometimes they use tolerance test that takes 2 hours to get results. And lastly, we'll look at how to treat diabetes if you're diagnosed with. So we use medications. We also encourage people to monitor their blood sugar, to use insulin pills or get insulin injection. So thank you for your time.